pick up from that failure? But it's
Yeah,
what you pick up.
Sorry.
Got it. But it's what you pick up from that failure and use it for the next time. That's important. That is what they're looking for. Not that it brought you down. Did it bog you down? Make sure you tell them. It did bring me down. It was something that really impacted me during a period of time, but then I picked myself up and I did better the next time. That's important because they want to know that you can pick yourself up from a failure and then get yourself back on your feet. That's an important quality to have in any residency program. Your residency may not be smooth. You might have a patient that's really bad. You might have feedback that's not going to be to your liking. But how do you receive that feedback? How do you pick yourself up? That's something that they want to know that you're going to be good at. So you know what, I always tell people that if you did have something on your CV that is not all rosy, it's in fact a good thing, because now you have a chance and opportunity to explain to themselves how you're better now, how you pick yourself up, which already puts you in a better spot than somebody who has a perfect pristine CV, right? You have an opportunity to explain, you have an opportunity to showcase yourself as to how you came back from that failure, which is a skill that is tough. It means that you are tough. It shows, it is an opportunity to showcase your toughness. That's a lot of tough in one sentence, but yeah.
We're very often asked, how do you embrace diversity? And this is a question that's probably common across several college panels. So what exactly are they expecting when they ask that question?
I honestly have never heard that question in any of my interviews as well as in ours. But how do you embrace diversity? The other thing, I think what they think is, coming from India, you are, you're not, you're thrown into this world where there are different cultures and different people, and they may feel that you may not adapt yourself as quickly. I think that's what they're trying to get to, because that's one of the biggest things for Indians, or I should not say Indians, but for non-Americans to come, adapt to the culture, adapt to the new medical system or dental system, and adapt to all these new people and mechanisms of giving feedback and all of that, right? But they don't realize that India is an extremely diverse place. You're already coming from an area of great diversity. So make sure you mention that. My college had people from all over India. We were already a diverse population. And so I feel I'm very well equipped to adapt to this situation. And that will be perfectly accepted. A lot of people who interview you may have the knowledge about India or about the colleges in India only from a few windows of other people, maybe a few other Indian dentists who don't really sit and talk about their college experience or what they go through, or maybe their, the culturals, and they don't have that knowledge. Their window of how they view India is pretty small. So make sure you let them know that you are already from an extremely well diverse country. So this is going off tangent, but a lot of times I find that I'm sorry, I know this is supposed to be behavioral, but a lot of times I find that when you give answers about why the US, or why this dental school, or what brought you here, make sure that you do not put your country down, right? You're coming here for better experience. You're coming here for maybe a more application oriented system, maybe for better understanding of higher technology, which we have all the resources, but it is also prohibited by how much patient can pay. So you may have the knowledge, the theoretical knowledge, but you may not be able to apply it to the entire population, right? So maybe you came here to use the technology, but make sure you do not put our country down, because that kind of, they want somebody who has a strong foundation, who has strong roots, who's going to stay loyal to the system. So if you're already talking a little bit about your dental school, or about your country, or about how people are, the politics there, and the caste system, try not to include all of that in your answers. What they want to hear is how good the medical system here is. But the medical system in India is, it has its own flaws, but it's by no means less than the system here. They have more technology here, yes. So make sure that you don't put anybody else down. And that applies to everything. Don't put your country down. Don't put your previous manager down, or any of that down, okay? Anybody else?
I have a question.
Yeah.
So I'll share one of the questions that was a kind of a curveball for me. So I was asked like, how would you convince me to do something that I don't want to do? So it was something where I had to think a lot, and I don't think I came up with a great answer. So if you're faced with something like that, it may not be just this question or just something random like this. What are they expecting out of you, and how would you approach that?
So they want to know that. So this is one of the. I think it's called stop, or okay, I forgot what it's called, but it's basically a safety mechanism, a safety check. And so what they want to know is if somebody is telling you to do something that's unethical, illegal, um, going beyond your duty hours, something like that, they want to make sure that you have the confidence to stand up and say, no, this is beyond my comfort level, and that you're confident enough to say, I won't be able to do that. Or approach somebody, some authoritative figure that you can talk to about this. So they're looking for several different things in this. One, do you stand by your principles of not doing something that A, is out of your comfort level? B, is first of all not even ethical, okay? And C, do you have the confidence to have an eye-to-eye conversation with either the person who's telling you, or do you have the confidence to go to somebody who's your authoritative figure and have a conversation about it? But it ultimately comes down to having a conversation, right? Most of your answers will come down to having a discussion, a conversation, an eye-to-eye agreement, you know? So what, you know, if you remember that that's going to be your ultimate answer, you can kind of mold every answer into that. But that's what they're looking for. So first of all, you can, you need to know what's right or wrong, right? If you clearly know that somebody is asking you to do something that's wrong, for instance, look up a patient which is not even your patient and let me know the details, blah, 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 which is, first of all, a HIPAA violation. So, you don't want to do that. But if it's your superior, do you have that confidence to say no to them? Which is really, really hard for people coming out of this country, right? Because we are so used to going by whatever our superiors say, especially if they're in an authoritative power, role. It's very hard to say no to them. So what they're asking is, do you have the confidence to seek help? Do you have the confidence to stand up to your own principles? That's exactly what they're asking. And so this whole communication, I will have a conversation with them. It applies to every answer that you can possibly tell, which kind of segues into our communication, behavioral questions. Like, tell me about a time that was challenging for you. You talk about the problem, you talk about what you did, but eventually the result should be how you had a great conversation with them and about how you guys came eye to eye about a certain thing. It all comes down to sitting down and having that conversation. Okay. So if you remember that and make sure that that is kind of your endpoint, and of course you don't have to say we had a great conversation, but you want to make sure that you had that discussion and you guys are on the same page.
Mm-hmm. That makes sense.
Have you had the opportunity to interview somebody on Zoom?
No, thankfully all my interview times were pre-COVID. So unfortunately I don't have too many pointers on Zoom.
Okay, given that you cannot really establish the same kind of a conversation you can do offline or meet someone eye to eye on Zoom, do you think that is something that people should keep in mind? Can they stay as animated as you are?
Oh, yeah. Well, that's true. There are different spectrums of animation when people talk on Zoom. But, smile. You can never, well, you can smile too much. I was going to say you can never smile too much, but yes. Make sure you look, fresh. Make sure you look positive. A lot can be said with just your eyes, okay? You don't need body, you don't need hands, you don't need anything. A lot can be said with eyes. Look honest, look involved. But those are body language through Zoom is not my forte. But all I can say is, be involved. Yeah. Do we have any more questions? I thought we could go through some behavioral questions and some answers that we used to make. I mean, some answers that used to make us cringe. I thought I'd go through some of those.
Of course, yeah.
Anyone?
She has a question.
Yes.
I have a question. in one of the interview, I was asked, like I practiced in India for 3 years, then I came here. It's almost like 4 years since I came from India. So the interviewer asked me, so it's been like 4 to 5 years since you actually practiced dentistry. So I didn't know how to answer that. And she was like, I know you practice for bench test for giving the practicals and everything, but beside that, you don't have any real world experience in dentistry from past 4 to 5 years. How am I supposed to answer that?
Well, that's a great question, and it will definitely be asked because the number of years that you're away from graduation matters to them, right? They want somebody who's fresh, as with any other career. So, and if anybody else had several years of a gap where they were preparing, this is definitely a sure question. Did you have any shadowing experiences in between? Okay, so build upon that. But then one of the things that you can say is, I mean, your foundation that dental school gave you is like your ABCs. It's like swimming. You cannot forget it, right? Yes, you've been away from the field, but you've been shadowing. You've been theoretically making sure you're on par with everybody else. But that's your foundation. Those are like your ABCs. Tell them, do we forget our ABCs? No. So it's all muscle memory. It's going to come back. And what matters is, are you up to date with what's going on as far as technological advances? Have you been shadowing people to make sure that you know exactly what's going on now in this medical system? But you don't really, yes, you lose it if you don't use it, but it takes a couple of months. Your transition is going to be harder. And make sure you mention that you know that your transition is going to be harder compared to people who have been working continuously. But that doesn't make you less of a candidate. Of course, you cannot say that makes me less of a candidate, but you should say, yes, I've been away from actual handwork for 3-4 years, but my foundation is strong enough that I'm confident that with maybe a little bit of a delayed transition, I'm sure I'll adapt just as well as the next person, right? And then once you say that, so you want to make sure that, yes, you admit that you've been away, but yes, your transition is going to be difficult, but you want to, now's the time that you will mention everything that you've been doing in between to make sure that your skills are up to date, right? I don't know if there are any simulators for dental schools online, like for the medical field. There are a lot of simulators. There's a lot of TALS online simulation where it gives you the prompt and you have to do something to the patient. It's not the same. I don't know. Is there something like that for dental school? Okay, then never mind. Forget it.
But they're anyway practicing at home, so they don't need a simulation because they are getting practice.
You're getting practice. Excellent. Make sure you mention that. I'm practicing on, I don't know who you practice on. You practice on your husband, tell them I don't know if you guys are married. You practice on the neighbor, make sure you mention it.
The thing is, we are not technically allowed to practice over here. So
that's true.
She was like, so you have been practicing at home. I know that, but beside that, do you have anything? So I was like literally thrown back, like, what to answer for it.
Well, if you have shadowing experiences, you should mention that because tell them how, because first of all, getting shadowing experiences is no joke, right? You to take the effort and to get that opportunity is showing something about yourself. So make sure you mention all your shadowing experiences. Yes, it's not something that you did. It's not actual work, but watching is one step before doing. The more you watch, the more you know. So that's, yes, it's tough to answer that question, but don't pause at all. Tell them about all the experiences that you've had, all the shadowing that you've done in between to make sure that you are still up to date with what's going on.
How significant hours continuing education classes are there?
I'm so sorry, what's that?
How significant are the continuing education classes? Should we mention there or?
Yes, anything educational that you've been doing in between, make sure you mention it. Is that am I understanding this question right?
Yeah, continuing education, CE courses.
Like CME? Okay. Yeah. Okay. Yes. Yep. You should mention it. And I don't know if in the dental field you accumulate points for continuing for CE, or we call it CME.
Yes.
So you can always say, I've been already accumulating points, and so when I joined residency, I already have a backlog of points that's going to add on to my CME or CE, whatever you call it. No, that shows anything that you did in between, academic or otherwise, that contributed to your knowledge base is showcasing your the efforts that you put in, your interests. So you should mention anything that you did.
Maybe Dr. Nourah knows about this. How that significant are the continuing education classes through self-study? Like they are ADA-CAAPID recognized, but that are just self-study and took the test and we got the C hours. How significant
Yeah.
or how
As
important
Dr.
are they?
Kavi said, it doesn't matter if it's ADA certified or anything else. What she says to you is that anything that's educational, that's adding to your knowledge base, is showcasing to the interviewers that you are interested in dentistry and you're doing as much as you can to get yourself familiarized with the American way of dentistry. So it's always beneficial to talk about that. Yeah.
Okay. Thank you.
Okay, now I'm going to okay, so let's go through one of the most common questions that they ask. Okay, it's tell me about a challenging situation, or tell me about a time when you had a conflict or this. Okay, let's do this one. Tell me about a time that you received criticizing feedback, and how did you receive it? Because people are really big on feedback here, right? Okay, they want to know how you receive feedback. They want to know how you give feedback. They want to know, do you use a sandwich mechanism? A sandwich mechanism is you say something good and then you say something, you kind of brush it up, and then finally you say something that they can improve upon, right? So they want to know everything about feedback, right? So tell me about a time that you received criticizing feedback. Okay, so and it's going to be hard if I go through every single person, but why don't we have a volunteer? One person.
Come on, guys, this is your best opportunity to get critiqued by an expert.
So before that, the three most commonly asked behavioral questions, because people are not as creative as you think, okay? They are not going to, a lot of these people who are in these interviews are very normal people who have lives, who this morning rushed out of their houses, prepared breakfast for their kids, and are exhausted already, right? And so they're like, okay, I'm going to look at this sheet of paper and I'm going to ask these 5 questions. They're not going to sit there and be like, how can I ask the most creative behavioral questions? No, it's not going to be like that. Very normal people, okay? So prepare the most normal questions as well as you can. So one is, tell me about a time that was really challenging for you, and elaborate on it. Or tell me about a time that you responded to feedback that was criticizing. Tell me about a time where you were not in agreement with a superior, and how did you deal with that? This is a good one. And then tell me about a time that you worked well as a team. Okay, these are like the 4 common ones. So remember these 4 common questions and forget these 4 common questions first, okay? Think of 3 stories, just 3 stories in your life. It can be anything, okay? And when I say anything, it need not be in something to do with your dental school. Were you in your cultural team? Did you have a fight with your seniors about who got to dance for the next show? Make sure you make a story out of it. Okay, because those are the things that are going to capture the interest of your interviewers. Remember, these people are by 11:30 hungry. Okay, they want to go eat lunch, and so they do not want to hear some run-of-the-mill story. They want some interesting story, and I'm speaking out of experience. Okay, they are not getting donuts in their room. They are all ready for that lunch that's waiting for them. So make sure you build up on something that's a little different, that may be a little bit out of your academic interests. A dance story, a cricket story. Were you part of a cricket team? Did your mom catch you and tell you that you cannot play any more cricket because you had to get into dental residency? Spice that story up. So those are little things that you want to look into, okay? Or once you came here, did you have a long journey? Okay, like I was reading Nourah's story where she traveled by bus and she got shadowing opportunities. Do you have a story like that? Make sure you build up on that. How was your journey here? Name one specific incident, okay? Like my husband was apparently he was telling me several years later about how when he was in his USMLE journey here, he would drink one Dunkin' Donuts coffee in the morning, one Dunkin' Donuts coffee in the evening, and then that's all, because he had to save money to go get all these observerships. Do you have a story like that? Make sure you mention that, okay? That is the kind of story that they're waiting for. They have a lot of these dental candidates from here who do not have the same financial constraints that you guys have, right? So build upon this. Did you go by mega bus, and was it really scary for you on one particular journey? But you got that observership, and you were extremely excited about that observership that you got. Make sure you mention that. Okay. So these are just, why I mention this is because don't feel the need to look back into specific conflicts with your professors in college. Okay, about how they were right and you were wrong, or how it was about a disgruntled patient. It may not be like that. Okay, look a little deeper. It could be a conflict with your sibling. So look a little deeper and bring out those stories in you, because that's what the interviewers want to know. Okay, sorry. So now who wants to volunteer?
Can you repeat the 4 questions that you said?
Oh yeah, see, this is why I should have made a PowerPoint. I'm very sorry.
I'm just noting them down.
Why don't I do this? Okay, why don't I type up some of these questions, and I'll send it to you guys.
No problem. We have this recorded, so.
Oh, okay. And you know, I didn't reinvent the wheel or anything. You type up the most 4 common behavioral questions on Google, and 10 of these will come up. But I'll make sure I send it to you. Okay. Okay. Yeah. So why don't we have a volunteer to talk about feedback that was a criticism, criticizing feedback that they received. Yeah.
Okay, criticism are the important and significant aspects for the professional life, and it determines the how we are doing and what others are accepting or feeling about it. And when I get such a criticism, like negative criticism, and in that time I need to see myself, how did I do? If is it there anything, should I improve or not? I have to look upon that, and I should not take that as a negative energy. I should convert that negative energy or something criticism to something positive, so that I can do better for the next time. And that is how we grow up and go towards the path of success.
Yes, and everything you said is absolutely correct, right? But what I really want to hear is, I want to hear a personal story. I want to hear,
for example.
Yes, everything that we ask is for example, okay? So I want to hear something about your life. I want to hear about when you were shadowing, if you shadowed somewhere, or, you know, if you, I guess for criticism, I think it's best to take an example from dental school, because, you know, let's say you didn't do so well with a patient, and or you injected some, I don't know, some wrong dosage of lidocaine.
Something that that complications happen and got negative criticism. And for example, when I was extracting the teeth, and the mandible got fractured, and I had to refer that patient to the specialist, and I got a bad criticism. But
so I'll be very careful. This is a great. I'm so glad that we asked. This is a good example, but it can also harm you. Now you want to give the criticism that you got, just a slight criticism, that nothing terrible that you did. Of course, I'm not saying what you did was terrible. It's a complication that can happen, right? But you don't want to showcase the worst mistake you ever made in this interview. Right?
Okay. I'm just taking an example. I didn't do that though.
Okay. Oh. Okay. But you do want to take an example from your own life. Make sure. So before you go, okay. So you take 3 examples, right? Think about the worst times, the worst criticism that you've received. Okay. You think of 3 times. I mean, I'm sure we've all received bad criticism multiple times. Choose 3 out of that. Okay. On a spectrum of really bad things that you did to okay, not so bad things that you did, put on a spectrum, choose the one that was okay, not so bad. Like, did you forget to present a patient on rounds? Take that one. Did you receive bad criticism on that? Take that one. And let me tell you, okay, if you're coming to me on an interview and telling me that you are great about taking criticism, I'll be very skeptical, okay? It's human nature not to take criticism well, right? So if you come and tell me that I was really happy that I received this criticism because it made me grow. That's a great answer. But is that really true? Will I see past that? Probably, right? Because all these interviewers, some of these are fairly newer interviewers, but a lot of these interviewers are seasoned, right? They're gonna see past this. Tell them you were crushed. Were you crushed? Tell them you were crushed, right? Because that is human nature. But did you come out of that? Did you eventually, once you calm down, realize that yes, what you did was a mistake and that you were able to improve the next time? That's what they want to hear, right? But it's okay to tell them how you felt about it initially, because that is normal, right?
Just to add on to what Kavi said, it's also okay to say that you took help, and people appreciate it here. Like when I answered the same question in my interview, for example, I said something like, my manager said I was unproductive. And here I was exhausting myself 15 hours a day and thinking, how the hell can I be unproductive? And I was totally like upset. I couldn't even fight back because I was thinking like, why can't this person see my work all this while and he's the one appraising me? It was super irritating and I just couldn't convince myself. Amidst all the rage, the only good thing I did was to take help. I actually went and bounced this idea off somebody else, another colleague who had been seeing me slogging and making jokes about it, at night. So I passed this on to her, and she mentioned that the problem with me was that I wasn't being unproductive. I was actually raising my hand too often. Taking up too many initiatives on my plate and not managing them equally and making an equal impression. So I realized that if productivity is like output by input, my input was very high, but my output was very low in comparison to each task. So, okay, that's a very non-medical answer, but
no, you don't need a medical answer. That's correct.
Yeah. So it's okay to say you took help. It's okay to say that you were counseled. It's okay. That's what humans do, and that's what they want to know. Yeah.
Yes. Yeah. Make sure you don't project yourself as a non-human stone. Okay. Because people can see through it. Okay. So that's why it's important to be honest. Let me give you an example of two other really impactful interview candidates. Okay. One was a guy who interviewed for residency. He, of course, was an American. So his experiences are completely different from what we come from. We have known 12th standard, studying for dental or medical, going into college, studying that, and then coming here. We have no experiences outside of this, unless otherwise you took a break here or did something, or your parents were cool enough to let you do something else in between, right? So, but this guy, and why I'm telling you the story is why it's important to take stories from outside the academic part of you, right? This guy, he was after his high school, he worked at a movie theater selling popcorn, right? Just to make money. And eventually he was really good at selling popcorn. I don't know how you can be good at selling popcorn. Maybe he showed up on time or whatever, but he was promoted to working in the theater, like selling tickets or one step higher. And eventually he did so well that he was promoted to manager, and he had 20 people under him in the theater. Now, what does a theater have to do with medicine or dentistry? Nothing. What does it have to do with anything that he's doing professionally now? Nothing. But what he did was he slowly climbed the ladder, and he was a manager, and he had 20 people working under him. That speaks so much. And so the reason he said the story was when somebody asked, what do you do for fun? He said this preamble of a story and then said, well, now I have my basement set up as a small home theater and I host movies for my friends. So that was his story for what he does for fun. But he just spoke about his entire leadership career before that with this one question, what do you do for fun? So, most of us don't have exciting stories like that, but, you may have led a team. I keep coming to the example of cricket and dance because I feel like that's kind of what we all resort to in India as our extracurricular, right? So whatever your extracurricular was, if you led a team, if you choreographed it, make sure you mention that because that shows leadership skills, right? Okay, what I'm going to do now is, does anybody else want to volunteer to take a stab on this question? Why don't we do this one? What was the time that you or what was the situation that you found challenging, and how did you approach it? Which is a very vague question. I mean, honestly, there are so many challenging things on a day-to-day basis. But does anyone want to take a stab at that? And get ready, because next we're going to go around and everyone's going to tell me one strength of theirs and one weakness.
Before that, I just wanted to ask one more thing about the criticism question.
Mm-hmm.
So when I was asked that question, I spoke about destructive criticism. I didn't speak about constructive criticism. So what do you think about talking about destructive? So I spoke about how when I started my journey to dental school, I was criticized saying I don't have enough experience and I shouldn't go on this journey because I'll never make it. So I spoke about how I came over that criticism and I still continue to pursue it because I knew what my strengths were. So I was kind of talking about my strengths, but what do you feel about covering destructive criticism?
Honestly, I think it's more challenging to come over destructive criticism. But I think what interviewers are looking for here specifically is how you take constructive criticism.
How you take constructive criticism.
Yeah. I mean, it's okay to mention destructive criticism, but again, there's a small part of perception that plays into if the criticism is destructive or constructive, right? I mean, yes, in your case, clearly it looks like it was not the most helpful criticism, but I wouldn't even say that was criticism, because that wasn't looking into one particular quality of yours and giving feedback on that, or one particular thing that you did. It was just an overall vague, you won't make it, right? So I would probably look a little bit into specific things that you did and specific feedback that was given for that, which is again hard when you come from India, because we get blanket statements and not feedback on specific things. Yeah. But what they're looking for is how you responded to constructive criticism, because destructive is not helping anybody, and you know, everybody was probably going to have the same reaction to it. Like you're going to feel really bad, and then a lot more comes into play then, because it basically depends on your own resolve as to how you're going to overcome that. So I think it's better to concentrate on constructive. Okay. Yeah. And I mean, you must, and for everybody here who's done shadowing, I would pick up on feedback that was given during your shadowing. Like, did you work with other residents? Were they kind of annoyed that you were around, or did they say that you need to do more or read up more? And did you find all that? How do you respond to all that? I think picking up from specific feedback that you received during your shadowing experiences goes a longer way in these interviews than something you received in India, which I find that we do not receive enough feedback in India, specific feedback. So try to pick up on those. Nobody wants to tackle what did you find most challenging? Remember, it doesn't need to be anything from dental school. It can be your journey here in the US also.
Yeah. Can I?
Yes.
Because I don't want, because I want to give other time, because I'm very poor at speaking, so I want to practice more. That's why. I'm sorry, guys.
No, of course.
Okay. Talking about challenging time, right? Okay. In 2016 October, after coming to the United States, things were very new to me. I did not know many things about the culture, way of life, and societies over here. And I did not have job as well, but I got a family, my wife and a son to take care of as well. And being a professional from the being the professional from the country, home country, so I had various challenges to adapt the situation here. But I took the challenge very in a good way, that I started working as a cashier in some convenient store, and I started adapting to the situation and people. I started meeting and talking to the people, and I started knowing them well, and I mixed up well with the culture. Having said that, it was challenging, but I took that in a positive way to upgrade myself and improve myself.
Yeah, that's good. Yes, that must have been very challenging for you. So that's a good answer. I don't know if I don't know if I would use the words like upgrade myself. But that's yeah, I would use the word adapt. But yes, that's a good story that you found adapting your challenging, and the very fact that you took on a job as a cashier in a gas station, it speaks volumes about how you were a professional, but you're ready to take on a job like this.
Okay.
So yes, that is a good story. That's a good story about your journey, but what they want to hear is, so I don't know if you guys have heard of the PAR method.
Okay, 1 minute.
Yep.
In 2015, I'm from Nepal. Nepal was stricken by the earthquake, massive earthquake, almost 8 Richter scale. And can I talk? Is it okay to talk about that?
Yeah.
Massive earthquake and things were challenging. And yeah, as a health professional, I had to go to the field, as well as I had my family who, even my house was broken or destroyed by the earthquake. So that was challenging time I had to face, and I faced it, and I did both jobs, taking care of my family, as well as I helped building shelters and helping people who are in trauma, physical, social.
This is an excellent story. I would use this story, okay? But also, when you guys tell stories, when you give answers to these questions, I would. Are you familiar with the PAR method or the STAR method? So basically, PAR is you think of the problem, which in your case was the earthquake, right? And you had family and your duty calling to deal with, and then what action did you take? You were able to manage. You went along and you had a strong resolve. And what was the result? A betterment of Nepal. I guess that's a very broad, vague term. So I would think of a better result, and so I would think of it that way. So think of every story. And again, oftentimes what we do is we focus on the problem, we focus on what we did, but we're very scared to actually, not scared, but we forget that we need to talk about a result. Like, was the result, every story, like what was challenging? What is the problem? Was it a colleague who was annoying? Okay. What was the action that you took? You had a good conversation. What was the result? You need to not forget to talk about that result. So you said, I faced the challenges and I took care of my family, but what was the result, right? You talked about a challenge, you talked about an action. So for all of you, when you answer these questions, think about, he had a good story. Think about all the stories that you can pull out and you can use for these answers, but don't forget to include all the components, which is, what was the result? Did you have a peace of mind? Did you and your colleague get along better? Were you able to take care of your patients better from whatever problem and action that you took? So make sure you cover all of that. For example, I would really like one more person to give an example.
Maybe Sonika. You're on mute. You're on mute.
The challenging time question.
Yep, you can. Why don't you choose either one? Whether it's going to be criticism or challenge that you face, I'm good with either.
Okay, I can answer the criticism question. So during dental school back in India, I had worked really hard on kind of this research throughout my final year of school, and I presented it on research day, and I had a very good mentor, and the research topic was really strong, and I worked really hard on it the entire year, and a lot of faith that I would win the presentation, but I didn't. And the criticism that I received from my faculty was that I wasn't good at presenting it, even though I had a strong, my PowerPoint or the poster was strong, but I didn't present it in a good way. I wasn't making eye contact with people. I was too nervous, etc., etc. So after I took that criticism constructively, I worked with one of my other batchmates who was really good at presentations, and she's done international, national level presentations. She trained me, and I had a similar opportunity in the US. I did a program at UCLA, and the same thing. I worked on the research and I made a poster, and we had the UCLA's Research Day, which was much bigger than what I'd done in India. I was competing with international residents and all the other domestic students, and I was the only international student in that presentation. But because I had practiced and actually worked on myself at better presentation skills, I got the first place there. And in the appreciation I received from my UCLA faculty was that you were very good at making eye contact with everyone, and you actually presented the research really well.
That's a great story. That's a great story. You had a problem, you took action, and you had result. Wonderful. Okay. Yep, I would totally use that.
Awesome. Thank you.
Yeah, we are short of time. Oh, my eyes. So why don't I go through some of the answers that would make us cringe, okay, for some of these behavioral questions. Because, oh shoot, I want to go through everybody and ask one strength and weakness. Why don't we go through that? Because I haven't even heard some of these voices yet. Let's go. Sudha, I think Sudha's first on my list.
So one of my strengths, I believe, is self-motivation. Do you just want me to name one, or?
Yeah, you can name. Nope, you can name one.
So that is self-motivation for sure. That's one.
Actually, you know what? Yes, you want to name one, but when they ask you for a strength and a weakness, what your strengths and what your weaknesses are, they don't want you to just name it, right? They want you to kind of back it up with a small example, not something long, because remember, in interviews, brevity is key. Okay, you don't want to give elaborate answers. You don't want to give very short answers also, no one word, but give them a little bit, okay? Like, for instance, all of us, okay, have come from India and just securing all these electives and going and you know, if you don't have family here, staying like a nomad in different places, that's all self-motivation. So make sure you give one of those examples. Like, I went to Timbuktu, to the middle of nowhere, just for doing my observership with no family there. And this was, you know, out of my comfort range. Like, I've always been at home. I've always been under the safety umbrella of my parents, but this was completely new for me. Something like that, if that proves that your self-motivation, that's a great example. So give a small example to back it up. Why are you self-motivated? I mean, if all of us are, because if we've left India to come here and do PG, spend all this money, we are all self-motivated. But what makes you what makes you unique?
I can't think of anything right now.
All right, we'll come back to you and think about it. But I want an answer before we finish this.
Yeah, sure.
And make sure that before you go for your interviews, all of you all think of 3 stories, okay, that you can pull out for these 4 questions. A challenging time, something where you responded well to criticism, something where you exhibited some teamwork, and what was one more that I said?
Strength and weakness.
Strength and weakness, yeah. One where you showcased your leadership skills. Okay, so make sure you have 3 good stories to pull out from, and you have it in this format. There was a problem, you did something, there was an action, and then there was a result, and you have to make sure that you talk about your result, because for us Indians, that almost feels like bragging when you talk about the result. Oh, you know, I had excellent patient care after that. So make sure you talk about the result. But yes, I'm going to come back to you for an example for strength. But give me one of your weaknesses. I don't know if has anybody watched Indian Matchmaking on Netflix? Yeah. So, you know, has anybody else, like one of the applicants, watched Indian Matchmaking?
Just one episode.
I did. I watched it.
You watched it? So yeah. you guys, you know, did you see Aparna? When Seema asks her, what is there something that you could change about yourself? And she'll say, honestly, there's nothing about me that I would change. Mm-hmm. That is the last thing that interviewers want to hear. Okay. Yeah. They want to make sure that everybody has weaknesses, but they want to make sure that you know that you have a weakness. Okay. And I know one of you is going to give me this answer when I go through weaknesses, and I want to stop that from getting to the interview. So let's hear some weaknesses. Since you're talking to me, go ahead. Give me a strength and a weakness.
In similar lines, you know, like you said, criticism, I'm a sore loser. Like, there was this instance when I had joined as a dental assistant here in the US, and my doctor and my colleague, both of them criticized me. Like, it was not direct, but I could feel it in their actions. So, and then I just ended up crying. I didn't turn up to the clinic for 2 days. I took leave. I was crying. I was having a lot of chocolate and stuff like that. But I felt like, I didn't need anybody to motivate me to go back to work again. Um, yeah, I just worked on it. I kept thinking a lot, and yeah, worked on it.
So I don't want you to think I'm criticizing your example right now, but I want everyone to I want everyone to learn something from all of these examples, okay?
Mm-hmm.
Now, perception is a huge thing, right? So now this is an example of how you felt criticized, although there was no direct feedback, right? So that won't be taken very lightly by the interviewers, because this is your perception of how you thought they were criticizing you, but there was really nothing actually said to you, right? So
Yeah.
this could be taken as a weakness by the interviewers, as to, well, maybe she's really sensitive, that she thought that they were criticizing her and she didn't go to the clinic for 2 days. So unless somebody gave you actual feedback, I would be very careful about telling them your feelings of what you felt like they were trying to say to you, which they actually didn't, right? So as much as I'm glad that you were able to get over it and go back to clinic, and that's good.
I actually went back to the dentist and spoke to her about it. So I literally took a feedback. I worked there for like 15 days, and then I literally asked her, what she wants me to improve on. So yeah.
Did she tell you something that was it anything constructive?
Yes, a lot of things.
So how I would phrase this is, I would definitely not in the interview tell them that you stayed back from going to the clinic for 2 days, because that is almost like running away from your problem, which 100% I would have done the same thing. Okay, so I'm not like blaming you. Okay, I know how it is when you go to an observership and everybody's just in their own world and they're not really into. I completely understand that, but what I would project this as is, you were in the clinic for 15 days and you just felt like there were unsaid things and that you could improve on such things. And so you stepped out of your comfort zone and you asked for feedback. Asking for feedback itself is a huge plus. Okay. Do we randomly on a normal day go around asking for feedback about how we're doing? We just assume we're doing a great job and move on, right? So asking for feedback is a huge strength, right? So by telling them this week, so you can tell, this is not one of your weaknesses that you ask for feedback after 15 days. So I would probably give this as an answer to how do you respond to constructive criticism, or how did you respond to criticism that was not very rosy. And you can tell them how you got all this feedback on day 15 because you asked for it, and how you improved upon that, and how you felt bad, but you did improve on it. But that is not your weakness. And I'm going to come back to you on your self-motivation and weakness. So let's give somebody else a chance.
In the interest of time, we'll just have someone else who hasn't spoken so far.
Yes, let's do that.
I think, Nikita, have you got the chance to speak so far? Yeah, and Preeti.
Okay, I'll speak about the strength and the weakness. I'll speak about the weakness first. My weakness is like I get stressed, I get tensed very soon. So recently, I try to control myself. Like I try to analyze why I get so tensed. So and then I started once I had taken a psychiatric help, and once I was told that if you count numbers backward, like say 30, 29, 28 backward, it tries to deviate your focus. And it's really helping me. And because I get so tense, I start shivering. And initially when I started doing my shadowing here in this country, I was so perplexed, like why I have to do this. But then I started doing the practice that was told to me, and I started analyzing my problem. It really helps me.
That's good. That's good that you found a solution to your own wellness, and you have that weakness, and that's fine. What is your strength?
Strength is I don't get influenced by anyone that easily because I try to control my own self. So I think that's the biggest strength I have, because many people I've seen get influenced by even a small thing, or it could be a large thing also, but I don't get influenced so easily until and unless that has an impact on my life. So
I would be careful for using that as your strength, because honestly, when you're in training, they do want to influence you in some way. So they don't want to work with somebody who's not moldable, who's not trainable, right? So I would probably phrase that as I am bound by my principles, and my roots are strong. That I always think through a problem without being easily influenced. So I would put it that way, just so that it doesn't seem like you're not trainable. It could be perceived that way.
I'll rephrase it. Thank you so much.
Yeah. Things that we really don't want to hear as a strength are, I'm a perfectionist. Okay. That is the most used strength / weakness, right? I'm a perfectionist, which is my strength as well as my weakness, because then I want everything to be perfect, and therefore I follow up on things. The most used one. Please don't use it. Okay. I'm a workaholic. Don't use it. Nobody cares. Okay.
Hardworking.
Yeah, that is my strength. As a weakness, used too many times. Too many, like literally 80% of people, interviewees use it. When you're asked to give examples from your life about a time that was challenging or anything, as I said again, try not to put anyone else down. Maybe a colleague, maybe parent, sibling, your country. Try to just focus on the qualities that you had and the values that you had, and not put anyone else down or shift blame on anyone. That wouldn't bite well for that answer.
Okay, so question: is it okay? Like when I used to do dental assisting, there was an associate dentist who was an Indian by herself, but born in the US. She used to always try to put India down. I mean, that was very annoying in front of a patient who is also an Indian. She says, "Oh, they don't give LA while doing restorations in India. Oh my God, how do you do that?"
Yeah, well, we all see a lot of that, right? So, but just try not to inculcate any of those answers, or don't give those as examples, because you don't want to project being disloyal to anybody. What they want
that was really frustrating all the time.
Okay, I guess we are out of time. I would probably take one last question.
Nikita, do you have anything?
I cannot think of anything right now, but yeah.
Okay.
I have a question if no one has. I was asked this just last week and I think I gave a horrible answer and I messed up my entire interview. The question was, what is a misconception about assumption that people make about you and you hate that assumption?
That's a great question though. Yeah. What did you answer?
Oh my God, I gave a horrible answer. Like I cringe at my own answer.
And tell us, we'll cringe together with you.
Because I was put on the spot and I wasn't prepared for it. I said that, and this is true, but not made for an interview. So I said that people tend to make an assumption about me that I'm really snobbish and that I'm a snob and I don't talk to anybody. But it's actually not true. So it really bothers me. And instantly the interview's question was, why would people assume that about you? And I said, I have no idea, because I really try my best. And I'm actually an extrovert. I love talking to people. I like to think that I have decent social skills. So it really bothers me when people assume that I'm a snob or whatever. I have just a little too good for everyone sort of a assumption. And he was like, do you think that's a good quality to have in a student? And that's when I knew, okay, I totally said the wrong answer. This is not something they want in a new incoming student.
So what they want to hear is, yes, that's a misconception that you get annoyed with, but it's also because somebody thinks that you're a snob. That's a good one. You can absolutely say that people think I'm snobbish, right? So then you can say, how are you trying to combat that? Are you trying to, so since I have come to know that some people think I'm snobbish, I have really tried to make sure that I smile more. It could be perceived that I have tried to change my tone of voice when I speak. I have tried to become more extroverted. You can try to say those things as to how you're trying to combat it.
I did, but I felt like he quickly picked up on the fact that, oh, we don't want this quality in an incoming student, and we don't want other students to think that.
Right.
He
Correct.
instantly got that.
Well, when he asks you, is that a good quality in the student? You should say, absolutely not. I don't think it is. Which is exactly why I'm making all these efforts to make sure that I'm not perceived that way, although I know I'm not that way.
Okay, but if I don't want to answer this in the future, I think it's not, I don't want to tread on these grounds at all. I think it's very shaky. What would you say is a decent, more nicer way to deal with this question, where you also say something good about you and not something so, dangerous, which could also work in another way?
A common misconception, but again, I don't know what misconceptions people have about you. That's a very personal question, no? So, are you a people pleaser? I mean, sometimes that works towards being kind of positive, but also negative. Sometimes people think I'm a people pleaser, and which I'm not really. Sometimes that's a good one. Honestly, I think people assuming that you're a snob is both a difficult answer, and how you combat that, it speaks volumes about you. And I don't, if that is the true answer that you want to give, I think that's completely okay.
Okay.
Yeah, I think
better,
because you want your answer to really be resonate with you, because it needs to come out with honesty, which it is coming out with you. And all you need to do is speak about how that's not a quality that you want people to see in you, or that's misperceived or misconceive about you, and how you fix it.
Okay, got it. Thank you.
Okay, everyone. I am going to stop right here, but you are welcome to shoot me questions. I'm not sure how. Karthik will now tell you how.
Well, okay, yeah. So thank you so much. This has been one of the best,
most energetic 1 hour of my life.
Good, I'm glad.
And yeah, sorry about the interruptions from our end at the beginning of the call. We've been battling power cut, which we thought will never happen in the US. So yeah, we've been going shifting places. Yeah, I'll follow up with the questions once people send them, and they all have our email ID, so they can mail us and we can forward it back to you. Maybe just a follow-up short video, if you can, like, record the key points you mentioned, 4 top questions, the 5 things that people.
I will do that. I also strongly recommend going through the Caapid Simplified website, because they do have a lot of the behavioral questions there, and all these answers that you might not want to, if you guys have not already gone through it.
Sure.
I think it's a good synopsis out there. Okay?
All right. Thank you.
All right.
Thank you so much.
No problem. See you all.
Bye.
Thank you.
Good luck, everyone. Good luck.
Thank you. Thank you.
Thank you.
Yep.
Okay. Bye bye, everyone.